I'm Joel Kavan. I'm from Iowa, just outside of Des Moines in Urbandale. Grew up there and went to high school, and then after high school, went down to Northwest Missouri State to undergrad. And initial major was kind of in accounting. Wasn't sure what I wanted to do, and then kind of switched and knew I wanted to go do something with medicine, and switched to biology and psychology and with the plan to go to medical school or hope to go to medical school at that point. And I went back to Des Moines to the osteopathic school in Des Moines to do medical school. And after medical school, went down. Initially, was going to study psychiatry and went to Menninger's just outside of Topeka to do my psych residency. And through the rotating internship, we rotated with a family medicine group in Topeka there with Stormont and St. Francis, and I really enjoyed family medicine and decided to switch at that point to family medicine after 1 year. So finished that residency there, and then after residency, I moved to Wisconsin for a few years and practiced in family medicine, and then moved back to Wellsville after my wife and our first child, and decided we wanted to be back closer to home. And she's from Topeka area and I'm from Des Moines, so thought the Wellsville area would be a good place to work. Through medical school and residency, I was interested in a lot of the specialties, dermatology, surgery, family medicine, psychiatry, but I think I stuck with family medicine just because I like to see, a variety of patients and a variety of medical problems. And I felt like there was a lot of all the other specialties in family medicine. So I've enjoyed doing that. Well, hopefully on our first visit, I'd have a chance to, we'd have some time to talk a little bit and get to know each other. But generally, a patient will fill out a history form, and we'll have time to review the history and medications and medical problems, as well as address any acute concerns. That question makes me think of in medical school kind of the um, 90% of medical problems can be figured out in the history and physical. So as long as you listen to the patient, so I feel like my practice philosophy would be try and listen to the patient, and usually they tell you what's going on. I guess with that, you always hear probably overused is a holistic, goal in dealing with patient problems. But I try and do that, and I feel like in osteopathic medicine, we try and do that. I would just say, uh, a lot of times I get the question, what's a DO and what's the difference between an MD and a DO? And a DO, there's a group of medical schools in the country that are is osteopathic medical schools, whereas MD is allopathic medical schools. We really do the same kind of training, and my residency was at an allopathic residency program, so we take the same boards. But in the osteopathic schools, they do some extra musculoskeletal training too that we get. At the time through medical school, I was leaning towards psychiatry, so I really didn't do a lot. So there are some DOs in the area that do manipulative medicine, but I don't. But it's kind of an exciting time for Ransom Memorial Hospital. It seems like there's been a lot of expanding in primary care with internal medicine, family medicine involved in the express care, and now the expansion of the emergency room and the emergency room physicians. I enjoy just having community of physicians that can be helpful, and the specialists that we have now too.